This is a demo for the virtual rounding and e-sitting features that enable virtual nursing, isolation room monitoring and other clinical use cases for the Carepoint TV kit by LG. First, let's take a look at how the virtual rounding feature works. When the provider is ready for their virtual visit with the patient, they can start the process by clicking on View Patient. This will allow the provider to observe the patient without directly engaging, allowing rounding without disturbing a patient's rest recovery. But when you click on Talk to Patient, the patient can see and hear the providers. Providers can switch to observation mode, which is the same as clicking on the Talk to the Patient button, by clicking on Begin Video Visit. A pop-up notice will appear on the TV screen and the patient can accept or deny the call. Providers can also invite other providers to join the call via email or text message right on the platform. You can control the camera's panning, tilting, and zooming. You can also share your screen with the participants. If the provider has invited another clinician or participant to the visit, they can choose Leave to allow patient and participants to continue to interact, or when finished, simply click on End Call for All. The Carepoint TV Kit 200L also has an e-sitter functionality. A provider can add patients to monitor. Up to 16 patients can be monitored per sitter. Sitters can also enlarge an individual patient's window and can control the camera's panning, tilting, and zooming. The sitter can speak directly to the patient. When the room is dark, you can still see patients with night vision. Night vision turns on automatically and appears grayscale. Learn how the Carepoint TV Kit 200L can help you deliver a better patient experience. Learn more at digitalhealth.lgnova.com.